Hey everybody, this is Preezy. Check out my website at www.listenuplistening5687.com. That's www.listenuplistening5687.com. You ready to chit-chat and all of that? You ready to vent, let it out? Well, come on now. Come on, collab with Preezy. Come on and be on Listen Up, Listen In as a guest. Contact me at 718-354-8405. 718-354-8405. You can also contact me by email, listenuplistening5687@gmail.com. One more time, listenuplistening5687@gmail.com. Let's get it. Hey everybody, welcome to Listen Up, Listen In podcast. I am your host, Preezy. What's going on? It's Friday. Aren't you happy? Are you ready for the weekend? I am. Yes. All praises to Jehovah God and Jesus Christ every day. Amen. And give yourself a round of applause because you woke up this morning. Yes, you woke up this morning. Yes, indeed. Always got to be thankful for that. Anyway, I have a great show for everyone today. I have a very special guest. And this topic, I'm not telling you. Absolutely not. I will not mess up with that. You just got to tune in to this episode. It's going to be awesome. You're going to learn a lot. You're going to learn a lot with this, so stay tuned. And I hope that if you are having a rough day, woosah, let it pass. Listen to Listen Up, Listen In podcast. I just said a rhyme. Anyway, come on now. Let's get it.
Tanya, you ready?
Listen up, listen in. 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 Thanks for tuning in. Let's have a conversation. Talking worldwide, it don't matter your location. What you going through and the topic may have relation. Let's get some motivation. Let's swap out education. Every Friday we heal, laugh, improve, and grow. Put some nutrients in your mind, give you food for the soul. I know you pumped and preparing for your weekend and low. Might as well join the discussion and tune into the show. Listen up, listen in. Listen up, listen in. Listen up, listen in. Listen up, listen in. Listen up, listen in.
Hey everyone, thanks so much for tuning in to Listen Up, Listen In podcast. I'm your host, Preezy. Now before I start today's episode, I would love for you guys and gals to follow me on social media. Go to Instagram, Listen Up, Listen In 5687, and on Facebook, Listen Up, Listen In. You can also email me at listenuplistenin5687@gmail.com. If you have any questions, comments, or concerns, by following me on social media, you'll be able to see all the platforms my podcast is on. Wherever you consume my podcast, hit the subscribe button so you can be notified when a new episode is posted. Rate, review, and share this podcast. Now let's get back to Listen Up, Listen In. Hey everyone, welcome back to Listen Up, Listen In podcast. Of course, you already know who I am. I am Preezy. And I want to thank everyone for tuning in to Listen Up, Listen In podcast. I have a special guest with me today. And so let me tell you a little bit about this gentleman. He is known to patients and staff as Dr. Clear Skin. He is a board-certified dermatologist, with a practice in Durham, the North Carolina Center for Dermatology, that offers cosmetic and medical services. And at the North Carolina Center for Dermatology, their philosophy is simple. Your care is the heart and soul of our practice. Seek to resolve issues of the skin, hair, and nails through a variety of medical and cosmetic treatments that work to provide restoration and healing. This doctor is dedicated to resolving both the medical aspects of skin, hair, and nail diseases and cosmetic considerations that will help highlight and celebrate the best you. So without further ado, let me introduce Dr. Jeffrey Scales, aka Dr. Clear Skin. Good afternoon. How are you, doctor?
I'm great. Thank you very much for having me. I'm looking forward to our conversation.
Yes, me too. And before we get started, I always like to ask my special guests, how is your day going today?
Actually, it's going very well. I live in North Carolina, and it's sunny and a little chilly today, but I always appreciate a sunny day.
Oh, that's great. Me too. In New York, it is cold. The sun is out, but it's cold. So, doctor, although I have said a little bit, gave my audience a little bit of information about you, I would like for you to please tell my audience more of Dr. Scales and what he does.
Yes, so I am a dermatologist by training. I also trained in pediatrics, and I'm a person who's been practicing for, I dare say, 25 to 30 years now, and I have a private dermatology practice in Durham, North Carolina, home of the Duke Blue Devils and right down the street from the UNC Tar Heels. And I've been in practice in this office 25 years. I specialize in taking care of medical dermatology, and we have an ever-expanding cosmetic offering where we help people to look their best and bring out their best. And I am someone who really enjoys working with patients.
That's awesome. So you specialize in those that are suffering from acne and any other skin diseases?
Yes, acne is one of our most common complaints that we have. There was a time when I thought acne was just primarily a cosmetic issue, and it is to some degree, but you'd be surprised how many people who have acne are affected to a great degree psychologically about having the damage to their skin, and it really is quite profound to them.
Oh, yes. Growing up, as a teenager, you go through those little trials and tribulations of your skin breaking out, and mama used to say, oh, stop eating all that chocolate, or stop eating this. And you always tried to figure out, why am I getting so much acne? Can you please tell us, why is acne here? What is causing it?
It's a great question because there's a lot of confusion around what causes acne. And there's a reason it happens when it does. It doesn't happen when you're 90. It doesn't happen when you're 5. It happens during the teenage years. And that coincides with the elevation of the sex hormones. So in women, that would be estrogen, and in men, that's testosterone. I always give the example that back in the early 70s and into the 80s, when people were using performance-enhancing steroids in the Olympics, there were certain things that people looked for. One would be that the person performed better, their muscles got a lot bigger, and one that was also on the list was the fact that they had acne. They would start to show acne in a way that they didn't before. And that's because both in men and women, they were receiving testosterone-based hormones that were increasing their strength and their ability to perform. So acne is a function of elevation of hormones that lead to all sorts of changes, which includes change in the voice, greater muscle mass, smaller body percentage. In women, it's widening of the hips, development of the cycle, changes in other aspects, and those things lead to increased acne during that time. There are adults that have acne, but the people that we probably focus on the most are the teenagers as they go through that process.
The teenagers.
So when people say, oh, it's chocolate and it's not drinking enough water, it's not using the right product line. Those things have never been shown to be true scientifically. These are things like your mother and your grandmother tell you, but they are not things that have ever been proven to be the case. So you can do all those things, but they still aren't going to cause you to have less acne.
Right. Because, we were always told, you got to drink enough water. You're not drinking enough water. Or don't drink too much orange juice, too much acid. So you're going crazy trying to figure out, where did this bump come from? It wasn't here yesterday. What did I do different that caused this bump to appear? And so you have to think about, am I eating right? Could that be the reasons too?
Well, there is some discussion about that now, and people are working on that now, trying to decide whether diet plays a role. Right now, I can't say it does.
Right.
But there are studies taking place now to try to prove that. So I would pause, and I'm going to say I can't say a lot about diet because we just don't have enough evidence to say one way or another right now.
Right. Now, I know that the skin is the body's largest organ, and there's going to be a lot of different changes in that. It could be health reasons and stuff like that. But what are some of the chronic skin conditions that you have actually encountered with your patients?
Well, probably the most common things that we see are psoriasis and eczema, acne, and there's a host of other diagnoses. There's 2,000 different diagnoses in the field of dermatology, but those would probably be the most common three that we see here. There's also skin cancer, which it's not a disease from the standpoint that it's a chronic disease. It's something that develops. At some point, it's very episodic. It's not something you just have and you have for months and years. But that is really a common finding in the office as well.
Now, when it comes to seniors, I know that they can get shingles. Have you ever had patients that dealt with that as well? I was told that is very, very painful. So...
Sure, so that's a good question. I'm glad you brought up shingles. Shingles is one of these things that's fairly common, and yet we have some things that we can do to try to prevent it and also to treat it. So shingles is chickenpox returning a second time.
Wow.
You have to have had chickenpox first, and then the chickenpox virus hides in the body, and it stays there dormant for years. And something will trigger it and make it return. And when it returns, it doesn't return looking like chickenpox. It returns looking like shingles, which is a rash on one side of the body, one place, not something that happens on both sides of the body. And it can be very painful because this virus comes down the nerve and it leads to blisters and extreme pain. And I know I've met a number of patients that say it's one of the most painful things they've ever experienced in their life.
Yes.
So thank goodness we have these great vaccines that people can get that will decrease that risk. Oftentimes I think people here, I'm going to go off slightly on a tangent that talks a little bit about vaccines, but vaccines are important to prevent disease and to keep people from being harmed. We live in a country where there's so much success at preventing disease that people get confused about what disease looks like and how common it is. I'm an older doctor. I've been practicing for a number of years, and so I'm old enough to remember when there were a number of diseases that we saw fairly commonly. Almost everyone got chickenpox.
Right.
You don't know a parent now whose child has had chickenpox, but it was something that a lot of children got. It could be quite painful. It could permanently scar. It was difficult for those around people, and it can be fatal. So now we have vaccines that prevent chickenpox. There were things that happen more commonly. There's one called pneumococcal bacteremia, which in pediatrics, it just means that you have a bacteria floating through your blood and it can kill you. There were infections that used to occur around the eye. Some of these things that can get in the bloodstream and end up in the brain and lead to death.
Right.
When I was practicing pediatrics, I certainly saw more than my share of young children that died from some of the complications from some of these diseases. And it's something that's so rare now that the average person has no idea if they saw chickenpox or if they saw measles or if they saw German measles. or whooping cough. These are things that just don't exist very much in our society. And yet people seem to think that they're gone, and none of these things are gone. They're still here. They're waiting for their opportunity, but they're still here. So when these vaccines occur, they are highly effective at preventing people from being sick. And not just sickness, but sickness that can lead to death or permanent hearing loss or brain infections. So I think sometimes we take a lot for granted. If you were to go overseas, people would stand in line, and do stand in very long lines to have access to just a fraction of the things that we get in the United States. Yet somehow it seems to confuse a lot of people here about what the purpose is and the benefit is of some of this really revolutionary medical therapy is.
Why do you think people are afraid to take these vaccines?
I think it's because they haven't seen the diseases. I mean, if you have ever seen someone that has measles, it's a horrible disease.
Wow.
Or if you see somebody who has, I'll give an example of my father-in-law who survived polio. But if you ever go back and look at documentaries about what polio was like when it affected Americans, people stood in line to get a polio vaccine. Young children died, older people died. He survived, but barely. He's crippled and has been crippled for life, and was one of the lucky few that did. But that was something that happened every year. That was something that everyone knew someone that had polio. And when an opportunity came for someone to get something that was going to prevent that, people stood in line and took it. I think people also have delved into this world of access to the internet and accessing people who have similar fears and confusion and lack of knowledge about many of the things that they are professing to talk about. It surprises me how people come see me and they say they've done research. They say, I've done research on this. And I ask them, well, how do you do research? Well, I put something into Google and I push a button. That's not research.
Right.
That's Googling something. That's looking at the websites that come up most commonly at the top that someone's paid to make sure they come up at the top. But that's not research. But people substitute things like that for actual knowledge or actual research. People can go and find some information about these things they really want to know. But it can be hard and it can be messy and it can be unclear. And people want simple answers. And oftentimes they get simple answers from people who offer simple answers without any reason to have belief in the things they see. So I think every American needs to leave the United States and go see what the rest of the world lives like. Mm-hmm. I had a great opportunity to go to Cuba just a month and a half ago. Phenomenal people, wonderful people, desperately poor and missing things that we take for granted.
Right.
And we are a society with a wealth of everything, one of the most successful economic societies in the world. And we have so much to offer, and people have the luxury of being able to ignore certain things. So I think there are a lot of factors. I've probably gone on too long discussing it, but I do think...
you're fine.
Yeah, I do think that success has led to people being complacent. You know, what you find sometimes with some of these people who ignore vaccines is when someone gets sick, though, with the very disease that they could have protected them from, they come to the office or they come to the hospital and they want any therapy at all that might lead to some benefit. Many that are not even fully tested yet. Because at that point they realize that they were wrong and now they want something that's going to keep their child from being sick or keep their family member from being ill. But prior to that, you can't tell them anything. So there's something inherent about people and their desire to be contrary and their desire to believe a lot of nonsense that other people are willing to feed to them.
Now, you said you've been doing this for many, many, many years.
That's too many minis.
I put too much.
But, there's too many minis. Let's just use one mini.
Just 1 minute. Okay.
Yeah.
Why this profession?
Well, I started originally as a pediatrician. And really, I guess you asked the question, why medicine in general? So I was raised my mother was an RN. My grandmother had been an orderly at St. Elizabeth's Hospital in Washington, D.C. And I always appreciated the care and the empathy that my mother would speak about in regards to trying to make some people better. She would come home and tell stories about patients and things that happened and things that happened with the doctors at the hospital. And she spoke very respectfully of the doctors and the profession. And I grew up liking science, and I just ended up in it after thinking about how much I would enjoy both the science part of it and also the caring for people part. That's the most rewarding thing about the career, is that you get an opportunity to really impact people's lives sometimes in a positive way. Not always. You try your best. Every doctor would love to cure every patient that they ever have, but that's never going to be the case. But I enjoy the impact that can come from trying to help people with knowledge that you have that can change their lives.
That's great. That's great. Now, let me ask you something. Can supplements or any medications affect your skin as well as having certain procedures done?
Well, supplements are nice options. I think everyone needs to make sure they get the important things in their bodies that are necessary every day. In history, in nature, people have achieved those things by eating healthy diets.
Right.
You go back thousands of years ago, people weren't taking vitamins. They were eating the foods that were healthy for them, that helped them to remain healthy. And that's the context out of how people got most of their supplements, is that it was healthy diets, balanced, that gave them the things that the body has evolved to deal with those things or accept those things in the context of food. Now, oftentimes we will add these other supplements and things hoping that they have some benefit. But one of the things that happens with supplements in the supplement world is that they're not held to the same standards of proof that, say, medication is. So if I have a high blood pressure medicine, I have to prove that it works. And I also have to prove that it doesn't hurt you. With supplements and many over-the-counter products, all they have to prove is that they don't hurt you. They don't have to prove they make a difference. So oftentimes we have a lot of science, pseudoscience. People heard about this and they were told this, and their friend knows this, and hey, they found something on the deep web that told them this. So it's not to say that those things don't have some benefits. It's just that they may not have the proof to say that there's some benefits. And in regards to that, people will say, well, that's just science not wanting to prove things that we know to be true. The way things are determined in science is that there's a method of going about knowing something. And what you do at the end is that you try to establish proof by how you approach something. So you might have two groups of subjects, and you give one group this supplement, and you give the other group everything except that supplement. And then you see what happens.
Right.
So that's a technique to figure something out. And what you're hoping to find is that there's a difference that occurs. So, or perhaps there's not a difference. At the end of the study, you may say, well, there's no difference, which means that maybe you need to do another study, or maybe you need to design the study slightly differently, or maybe you need to take some other things into consideration.
Right.
So when you're choosing to take things in your body, you have to be sure that there's something that supports why you do it. We all need certain vitamins. You need vitamin C. You need all those things. But many times, you can get those things from a healthy diet.
Right. Okay, so what's a healthy diet? Because some people get confused. What exactly is a healthy diet?
It's a great question. My daughter and I were talking about this. She's going into medicine next year. We were having this conversation about diets yesterday. And I am not knowledgeable enough to say what that might be. I can tell you what I think it might be, but I don't have any real proof one way or another. But I do believe that eating lots of healthy, good fruits and vegetables, and for those who will partake in meat, lean, healthy meat, and try not to be too dogmatic about all of it. I was listening to someone talk one time about that food has become a religion. Sure, I'm not the first one to say that because I heard it from someone else. But people will die on their cross trying to say that they're convinced that this diet or that diet is better, and should you have a keto diet? Should you cut out your carbs? Should you eat more carbs? Should you eat more only vegetables? Should you eat organic food versus food that's not organic? It's hard to have strong opinions, but it's not hard to have strong opinions. It's just hard to have strong science supporting something one way or another.
Right.
So I'm going to pause and say I don't have an easy answer for that, and it's a very good question.
Oh, okay. So I guess we have to do our research on that, huh?
Do the best you can. You have to
Google.
look at what's available and then make your own decision.
Right.
Yeah, that's a tough one to answer.
I know most doctors, your primary doctor, your heart doctor, whatever, they will tell you vegetables and fruit. I've been told that a lot of times. You gotta increase your vegetables. You gotta increase your fruit. Not canned goods. So I've been told that would help. But now, so you go to the pharmacy, you're looking for vitamins. This vitamin says hair, nail, and skin. I'm gonna pick that up. I need my vitamin E. I'm gonna pick that up. You got vitamin D. You got all it. Then you get the multivitamin. So you get the multivitamins. Then you get all these other side vitamins. And guess what? If you read, too much vitamins may not be good for you either. So it's just so confusing. You want the nice skin, the hair growing well, your nails. You want to be healthy, but too much of it might not be good. So now you're just so confused. Now, do you recommend vitamins that help the skin? As far as I know, there's one called hair, nail, and skin. Do you recommend taking a supplement like that or vitamin E?
It's a great question. There is really so many things that you could buy that give you some of the simple answers to complicated problems. And you said something I think is really challenging right now, is that we are given a lot of information, and some of it is contradictory. And you say, well, it says to take this for the hair, but this is this to take for the nails, and just so much information. And the fact is, these are hard questions to answer. There are not simple answers. People want simple answers, and I understand. I want the same ones too.
Right.
But I would love to say it's easy to figure out what this all means. I don't have an easy answer. Would I suggest hair, nail, and skin vitamins? We certainly have a number of people that come visit us who take the hair, nail, and skin vitamins, and they say that they seem to work for them. So I don't have an answer for that. I think it's worth investigating. If you're not careful, you'll end up spending all your money on supplements and things.
Right.
So I will have to say that more research needs to be done. More questions need to be answered.
Because you'll be eating more vitamins than you're eating regular food.
Sure. I think making sure you get some good regular
sandwich.
Yes, you end up with a bunch of stuff that maybe you don't need. Certainly the companies would love to have you buy them, but it doesn't mean you need them.
Right. How often should a person clean their face?
I recommend that people wash their face with some kind of gentle cleanser twice a day.
Okay.
I think if you do it too much, you can irritate the skin. If you don't do it enough, you can have overgrowth of bacteria and all sorts of things on your skin. So that's my general recommendation.
Do you recommend moisturizers as well? You know, as women, when we wear makeup, we tend to put on special ointment to take off the makeup, and then you have to put on moisturizers as well. Could that be a problem too, as far as clogging the pores with makeup and all these different things?
It's always possible that you can clog the pores if you use something heavy on the skin. I think that a moisturizer is necessary if your skin is dry. I have patients that come see me who are acne patients, and maybe they're in their teens or early 20s, and they feel very strongly about using moisturizers. Moisturizers are designed to keep the natural water that's in the skin present in the skin. So when you put a moisturizer over top, what you're trying to do is seal in some of the natural water that's already there and perhaps add a little bit to it as well. If you're already an oily person, like some of the people I mentioned moments ago, then you don't necessarily need a moisturizer. Oily skin is a natural moisturizer. Now, as you age, you tend to have less oiliness to your skin, and you tend to have more dryness on the legs and things. So I think it's certainly important to add there to keep yourself comfortable. And I do like the idea of using moisturizers when necessary.
Here's the thing. There's a million products out there. How do you know which moisturizer to use? Or is that the time when we come see you? Because
it's a great question.
Yes,
it's a very good question. Because again, you have so much choice.
Right.
So much choice. So I think moisturizers, I think put them in two really big categories, or three. One is one that includes a sunscreen.
Okay.
So if you're going to be outside and you work day to day and you go back and forth to the car, a moisturizer for your face that includes a sunscreen would be nice. It can come many different ways. It can come very thick. It can come as thin moisturizers. I think that whichever moisturizer you're prepared to use and you feel comfortable with that matches those criteria is the right moisturizer for you. So I would like to see people find something that's unscented,
right,
that's comfortable in the skin for the time of year that you are involved. So for instance, this time of year is very cold here down in North Carolina, just like it is where you are.
right.
And I would encourage people to use some kind of gentle moisturizer. I have several brands I like: Cetaphil, CeraVe, Avene. We carry some products on our product line, the North Carolina Center for Dermatology Products, and they smell and they feel very nice. And so if you like it and you're prepared to use it regularly, that's a good moisturizer. For the body, we tend to recommend thicker and heavier things than what we would use for the face. The face tends to have more natural oil that is released, so you don't need anything quite as heavy. But yes, I would also use those same brands that I just mentioned that you can find for a body moisturizer.
Now, we see our primary doctor once a year. We see our cardiologist once a year. And maybe there's other doctors that people see once a year. Should a dermatologist be part of that group once a year and not wait until something, oh my God, look at this on my face? Should you see a dermatologist at least once a year?
So I think that many people would benefit from seeing a dermatologist once a year.
Okay.
There are some people who are at higher risk than others. So people with very light skin and who have had significant sun exposure, they would benefit from seeing a dermatologist regularly, once a year. As we age, if we've had a significant amount of sun, I don't know if you ever visited the desert Southwest and you look at people's skin out there, and you'll see that a lot of people have sun damage. They have leathery skin. They've been in the sun quite a bit. You can see the same thing if people go to Florida. People who have been out and have more sun than the average person can end up with sun damage that requires that they are monitored at the very minimum once a year and sometimes twice a year, if not more. People who have had a history of having skin cancer are people who should be at the dermatologist regularly. So I wouldn't say every person in the country needs to see a dermatologist, but I do think there are a number of people who would benefit from it. That's talking strictly in terms of sun exposure. There are other reasons to see the dermatologist. Those are things like the fact that you have itchy skin, maybe you have psoriasis, maybe you have trouble with your hair, you want to look your best. These are things that can be addressed at the dermatologist that don't require having had a lot of sun.
Now, I have another question regarding the skin. People that have like the dark circles underneath their eyes,
Mm-hmm.
is there anything that could be done? I was told, because I kind of suffer from that. Some people say it's hereditary. Some people say it's broken capillaries. And then there's others that say, oh, you can try to bleach it, but it'll never go away. What can be done about that?
Sure. So there's a number of treatments for this. One that comes to mind is, as you mentioned, some creams that you can put on that will help lighten the skin. They work by slowing down how much melanin is made in the particular area where you put the cream. And there are some things that you can buy over the counter that say that. And then there are prescription levels of this medication that can be used to assist and to do the same thing. The prescription items are stronger and tend to do a better job.
There's side effects.
Sure, there's nothing without side effect. I always give the example of water. So this is a tangent, but bear with me for a moment. So your body is 70% water. You need water to survive.
Right.
There are people who drink excess water and kill themselves every year in the United States and around the world.
Wow.
It is a necessary item, and I'm not just talking about people who drown in the ocean and other places, but people who drink too much water. So, for instance, during marathons, my understanding is that there are many more people who overhydrate than underhydrate. They talk about the need to drink plenty of water, and you need to drink enough, but you can hurt yourself by drinking too much water. So even something that's necessary for life, if used incorrectly, can lead to complications. These creams that you're talking about can cause some trouble at times. In Europe, they've banned some of them because they feel that they can lead to significant problems. Hydroquinone, which is one of the most common creams, has led to quite a bit of morbidity in certain countries where people use very high concentrations of these creams and have led to systemic disease, things that hurt their body from the inside. So yes, that's possible. If used appropriately and in the concentrations that they need to be, these can be very helpful items. So creams that can lead to this issue. Now, there are other things. For instance, there's a new device that we have in our office called the Morpheus 8. It uses radio frequency microneedling, which just basically means delivering energy at certain levels of the skin, the top layers of skin. And that has been helpful towards getting rid of dark colors and for getting rid of bags under people's eyes. These things happen sometimes because of genetics, and sometimes they happen because of maybe changes in a person's health. So you can treat these things if you address them using those two things I discussed.
Okay, that's great. And what about melasma? That's something that I've heard also somebody talk about, melasma.
That is within that category of what we just discussed before. Changes extra pigment. Melasma means extra melanin.
Yes.
And it happens primarily because of changes in hormones. So you see a lot of women who may be taking extra estrogen for birth control, or perhaps they've been pregnant, or perhaps they have to take estrogen because of it helps them with their menopause years. Those patients will many times develop excessive sensitivity to the sun, which leads to having extra pigment. Sometimes changing some of these things, like cutting out the estrogen, can lead to the improvement that you're looking for. Many times we don't even know why people get it in the first place, so it's hard to adjust something that we don't know why it happened.
Right.
The treatments I described before that include hydroquinone as well as other things, the Morpheus 8 device, as well as other things can be, and other devices that can be used to help decrease how much pigment a person has on their skin. You can improve many of these things. You cannot necessarily make it go away forever, but you can make it a lot better. And these people need to be using a moisturizer with a sunscreen every morning as well.
Right, that's true. I've seen a few documentaries of people actually bleaching their skin, and I'm pretty sure that is causing a lot of damage. Can you tell us why it would be causing damage?
Well, it depends on what people use. So I mentioned the hydroquinone a few moments ago. That is a chemical that you put on your skin and it inhibits the development of extra melanin. If used too long and taken in doses that are too high, you can have trouble with systemic disease, things that happen inside the body. There are other things that people, and that is the number one reason that people have trouble with the bleaching creams, is the hydroquinone that's in there. There is a epidemic of people in certain countries in the continent of Africa who have used some of these things in an effort to lighten their skin and have caused quite a bit of trouble for themselves. So I suggest that people are very cautious about using these things, and I think that you're going to find that people will benefit from some of the things they're talking about, but they have to be very careful. It's like so many things. If used inappropriately, if used too much, you can end up with problems that you develop.
Right. So, of course, I'm in New York, and for those that are in North Carolina, it's important that they look you up, especially if they're having skin problems. You know, I always say don't wait to the last minute. That's why I believe that you should see a dermatologist, if not every year, maybe once every 2 years, or every 2 years, I should say. But I think it's important. I'm definitely going to make an appointment, because although my skin may look nice, but it may not be healthy. To my eyes, it may look good, but to the doctors, it may not be healthy. Is that true? Could that be possible?
Sure. Sometimes there are things that are going on that maybe you don't recognize right away. There are people who come to see me who have moles on their skin that they've been watching for months and years, and it turns out that they require some additional attention, perhaps a biopsy, and maybe some therapy beyond that. So yes, I think it's a very reasonable thing to have your skin checked on a regular basis, and let someone who spends their time on a day-to-day basis looking at these things give you some insight and perhaps some help.
Yes, definitely. Yes, and I was going to mention about moles too. That is something that, you're told to pay attention to as far as the shape and size, because it could lead to skin cancer. Am I correct?
Yes, they certainly can. Certain moles can. And sometimes skin cancer will just come out of normal skin. But yes, there are moles that can lead to skin cancer as well.
Okay, so what advice can you give to those, especially young kids out here? They're probably just throwing everything and anything on their face, and they're not really knowing what to do. And maybe if the parents are listening, they can give them advice. We all know we need to see a dermatologist. But what are some cleaning tips, again, that we can give to the young folks as well as the old? Because some people, they're not probably cleaning their faces properly either.
Sure. So I think that the things I would say that people need to focus on are, one, making sure that you clean your skin regularly with a gentle cleanser. You don't need a lot of stringent, you don't need scrubs and all that. You just need a gentle cleanser, hopefully something that doesn't have a lot of fragrance. And you use that twice a day. Use a moisturizer with a sunscreen, particularly if you're in a sunny environment, for your face on a daily basis. If you're going to be outside and you're going to be at the beach or the pool, then I think that you need to use a thicker sunscreen, a sunscreen that is better for being outside. I always say the ones that are waterproof, the ones that maybe are a little greasier, can be helpful when you're out somewhere where you're sweating or you're getting in the water, it's really sunny. So I think that that's something that I would highlight. Also, if you develop acne, you can try some of the over-the-counter things.
Right.
But if they fail, go see your dermatologist sooner rather than later.
Yes.
Sometimes by the time people have tried too many of these things at home and they come to see me, they have permanently scarred their skin. And that's something we would certainly hope can be avoided. We have a lot of options for people to avoid scarring their skin now.
Wow. What about facials? That's what I wanted to ask you. Facials, when you go to these spas and they offer these different type of facials and stuff like that. What about that?
Facials are nice. They are good to clean your skin. They remove blocked pores. And those are things that can be helpful. They're not going to change your skin as far as your disease states go. It's not going to improve acne. It's not going to decrease your risk of having skin cancer. But they can be quite pleasant. They can really clean your skin. It can make you look a bit more youthful. So I do think they have some benefits. We offer something like that in our office as well.
That's awesome. That's awesome. Well, Dr. Scales, a.k.a. Dr. Clear Skin, how can my audience find you?
Yes, so if you're interested in learning more about our office, our website is nccdermatology.com. We also have Instagram, and that's at ncderm, D-E-R-M, N-C-D-E-R-M. And we are available here in Durham, North Carolina for people that would like to come visit us. We can also offer you care online as well. So
Awesome.
my number is 919-484-9551. That's the old-fashioned way of reaching people. So those three ways are really helpful to reach us. We'd love to hear more. We're always taking new patients. We offer some unique things in our office. And if you're ever in Durham, North Carolina, drop by and see me.
Sounds great. Sounds great. I want to thank you so much for all the information that you provided. And I know I took my notes down, that's for sure. Because we all want our skin to be nice and beautiful. And not just that, we want it to be healthy. Because that's the most important thing, is being healthy. And so we don't want to wait till last minute and be like, oh my goodness, what is this? As soon as something is not right, you need to get there. But not only that, I really recommend everybody once a year to see a dermatologist. Add them to that list of primary care, cardiologists, and what other doctors that you see. Please add the dermatologist to your list as well. So thank you, Dr. Scales, for that great information. Thank you so much for being a guest. Appreciate you.
I appreciate it. Thank you for having me today.
Yes, and like Hey everybody, thank you for tuning in to Listen Up, Listening podcast, and I hope y'all enjoyed this episode. I know I did. Talking about the skin is so important. You see, we want our insides to be good, but we need our outsides as well, because when things are not going good inside, it displays on the outside. That's why it is important for you to make an appointment with your dermatologist once a year, once every 2 years. It doesn't even matter. You have to get there and see what's going on with your skin. You can have moles that are not normal. Anything can be going on, especially if you're always in the sun. You have got to make an appointment to see your dermatologist. Very, very important. And besides that, you want to look good with a glow. Don't you want that nice, pretty glow? Ooh. Feeling like a princess and a prince. Yes, it's important though. Forget about the looks and all. Forget about all that. It's about being healthy, okay? Healthy. So, go ahead, make that appointment. It's important. And if you're in the doctor's area, go and see Dr. Scales. There are so many dermatologists out here with no matter where you live, go make an appointment. But anyway, it's time for me to go. But before I do, I'm always gonna say, live, laugh, love. Love you first. Go on to that dermatologist. Love you first. Because you can't love anything or anyone unless you love yourself first. Stay healthy, stay focused. That's the key. Keep God in your life and hug and squeeze your family. And the pets, because they family too. Just a little bit tighter. All right. Love you, mommy and daddy, forever. Peace.
Yay!
Oh, thank you.
That concludes this episode of Listen Up, Listen In with your host, Preezy. Hey, yo, Preezy, tell them how to keep in touch, baby.
Go to Instagram, Listen Up, Listen In 5687, and on Facebook, Listen Up, Listen In. You can also email me at listenuplisten5687@gmail.com. If you have any questions, comments, or concerns, by following me on social media, you'll be able to see all the platforms my podcast is on. Wherever you consume my podcast, hit the subscribe button so you can be notified when a new episode is posted. Rate, review, and share this podcast.
Listen up, listen in. Listen up, listen in.